for you. I'm Stephanie with Channel 7.
When you ask simple questions,
Ada, can you talk to me, please?
and all you get is
Ada?
silence.
Ada, we just have a few questions for you. Can you please call me back?
This young woman claims to be a volunteer advertising free COVID testing on the Nextdoor app at several locations across Alameda County, including this one off College Avenue in Oakland, right outside Safeway.
Let me be clear. We have received concerns about that location.
Vasilisa Capilla is the COVID testing lead for the Alameda County Public Health Department. Her team receives 3 to 4 complaints about unauthorized test sites across the county each week. She says this site is raising eyebrows for not being transparent.
They should be able to say who they're affiliated with and how they're operating.
So we tried to verify that.
Ada, I'm asking you a question. You're on public property here, so I'm just here with a couple questions about your site. Can you explain to me where you're sending your samples? Ada?
And got nothing, just silence.
Some of the common complaints we're getting right now is that there's a one-person operation. It's unmarked. It's unclear whether equipment is being and supplies are being managed the way they should be, not really knowing who's behind it.
At first glance, a Hayward-based lab, Predison, is advertised at the site. Predison told the I-Team this site is run by one of their contractors, Red Shelf. Red Shelf collects COVID tests and gets paid for each test processed. Some viewers who visited the site wrote on Nextdoor, complaining they never got their results back. So the I-Team reached out to Red Shelf for further comment, but we didn't get a response.
Leave a message after the beep.
Predison declined our request for an interview, but did send us the following statement saying, Predison provides comprehensive standard operating procedures for each step of the testing process to maintain quality and consistency. We adhere to all regulatory requirements, including Clinical Laboratory Improvement Amendments, or CLIA, and College of American Pathologists. Copies of Predison's CLIA and other licenses are provided to each of our collection contractors. Alameda County health officials told the I-Team legitimate pop-up sites should provide the name and federal CLIA certification number of the lab used to process their tests.
Can you provide me the lab's CLIA certification number? Ada?
So we asked again.
Can you please provide the CLIA certification number?
Silence.
I want to believe you're here for the right reasons, but you're not giving me any proof.
That's a red flag.
Attorney General Rob Bonta says unauthorized or non-compliant test sites are becoming a statewide problem. We asked him about the refusal to give out the lab's CLIA certification at this site.
Would you consider that a red flag?
Yes.
Though it's unclear whether Alameda County public health officials will take any action with this site, others have been cited for not following protocols or worse.
Some of these sites are testing individuals and then, taking their money in exchange, but never providing a testing result or providing a fake testing result. Be careful, because there are scammers out there. This is real. This is a real threat.
And while this is a real site with red flags, that has already been kicked off Safeway's property after customers complained and store management told the I-Team the site was not cleared to operate on Safeway property. Yet the site just moved a few yards to the left, but is still operating.
We're definitely concerned.
7 days and counting. That's how long Marilyn Moore and Jenny Shao have been waiting for their COVID test results.
And they said they would call back. Well, they never called back.
The two took a PCR COVID test through Virus Geeks, a Bay Area-based biohealth technology company that has more than a dozen COVID test sites across San Francisco and the peninsula.
I have an update for you.
Okay.
We found out where your sample has been over the past week.
According to the company, turns out nearly 14,000 specimens collected last week have been sitting in a lab for 7 days, all untouched.
My goodness.
I'm very sorry about these events, and they have a right to be mad.
Virus Geek CEO Frank Lee reached out to the I-Team following our story, saying he takes full responsibility for what happened. Facing heightened testing demands from Omicron, he says his company relied on another Pleasanton-based lab, Diacarta, to help process the overflow. But days went by, still nothing.
Didn't feel right, so something's going on, right? We have a problem here, okay? Because now we're going on day 3, day 4, day 5.
When were you first notified there was an issue?
So that's an issue. So that's That's interesting.
Interesting, because Lee says the lab blamed the delay on a data error. But when his team showed up to check it out, they saw this.
To our horror, they were left in the bags, original bags that we sent to the laboratory.
Lee says the roughly 30 bags of samples are all from the company's test sites at the San Mateo County Event Center and the Monterey Airport.
Do they indicate to you what happened, what the problem was?
They said they'd have only one scientist. So give you an idea, to process the 5,000 samples a day, you need a minimum of 3 scientists.
The ABC7 News Eye team reached out to DeAcarta for further comment, but the company denied Virus Geek's sample bags were sitting in their facility for over a week, despite these pictures showing the company's tags on them in their facility. DeAcarta says a portion of the samples were processed, but admitted to the I-team, due to increasing workload from our own customers, we told them to take samples back. Virus Geeks has pulled back testing at all of their locations across Northern California as the company works to process the influx of samples left in these bags.
How long do you think it will take to clear out that backlog?
I anticipate by Thursday, everything should be done.
So we checked back. Do you think that will happen today?
I anticipate the backlog will be cleared up by Friday.
It's now been 10 days since these specimens were collected.
It essentially defeats the purpose.
Absolutely.
It defeats the purpose, but still comes with a price tag, billed to insurance companies. And ultimately, taxpayers will be picking up part of the tab for those uninsured. Plus, the remaining backlog raises concerns about the quality of the specimens. Lee told the I-team.
Samples remain viable up to 21 days in ambient temperatures. So, within room temperature, they're fine.
But Kenji Obadia, the manager of the Stanford Clinical Virology Lab, disagrees. Would you be concerned about the quality of specimens sitting in room temperature for a period of 6 to 7 days?
For me, it's very unlikely that you have accurate results if the samples are kept at room temperature for that up to that amount of time. And if the nucleic acid has degraded, you can have a false negative result.
Customers like Moore, for example, learned she tested negative from her Virus Geek swab last Monday, but was positive on an antigen test the next day.
Oh, I know things can change from one day to the next, but I don't know. It's fishy.
So we brought this to authorities in San Mateo County. What is your team doing to look into this?
San Mateo County is actively working with Virus Geeks to try to improve the test turnaround time situation. That unfortunately, there are staffing disruptions that have affected so many sectors, including test processing vendors, and with such high demand.
Virus Geeks has previously provided testing to several colleges and high schools in San Mateo County and hosted the largest scale test site at the San Mateo Marriott before expanding to the event center.
What are you doing to ensure that this doesn't happen again?
And make sure that we keep the volume to our capacity. For all you folks that are out there that are mad, I'm terribly sorry.
Fireman knew right away. He came and said it's going to be a while.
After a bad fall, Pleasanton resident Patricia Galley broke her leg and suffered internal bleeding. Her husband Don called 911 and fire crews arrived within 5 minutes.
They said, well, let's do something for your pain because it's going to be a while before we get an ambulance. And that's the first time I kind of asked, what do you mean it's a while? He goes, well, we're having some problems.
How long were you waiting?
A good 20, 25 minutes before we had the ambulance pull up.
The Galleys aren't alone. They are just one of 916 medical calls in Alameda County that failed to meet the standard response time just in December alone. Alameda County contracts with the European-based ambulance company Falck. We spoke to the company's chief commercial officer, Troy Hagan. Do you think it's acceptable for a Priority 1 call to wait 20 to 25 minutes?
That is not the goal. That is never the goal. So we want to respond within 10 minutes.
According to the company's contract, life-threatening medical calls requiring a lights and sirens response are classified as Code 3. In neighborhoods like Pleasanton, response times for Code 3 calls should be within 10 to 14 minutes, depending on the priority level.
Again, there's an expectation that on time is the only time that those services need to be here.
The company's contract requires it to meet response time standards 90% of the time, but compliance reports the I-team found and analyzed show Falck failed to do that in 2 of the regional zones within Alameda County in December of last year, and in 3 regional zones from August to November of last year. Your company's track record in August and September was concerning, and it turned out to be expensive.
Yes, of course.
Alameda County Emergency Management Services, which is the agency overseeing the county's ambulance logistics, fined Falck more than $200,000 last year for failing to meet standards.
This is probably the most challenging couple of months that I've experienced in my 33-year history in doing EMS, of just a combination of many different factors that all came together this fall.
Hagan says the two biggest factors that contributed to noncompliance are staffing. They're down 50 EMTs and paramedics, and long patient drop-off delays at hospitals.
We have multiple ambulances at one hospital waiting to transfer their patient over, and they're out of service, sometimes for up to hours for a single crew to deliver a patient.
I mean, that's a mess.
It's a mess.
That mess shifts the burden to local fire departments. We spoke to Alameda County Fire Chief William McDonald.
It's a snowball effect as it kind of spreads out, kind of like a ripple effect beyond, because we get further and further away and further behind in being able to respond to the emergent needs of our community.
Are you hearing fire crews are having to transport patients on the rig of fire engines in order to get them to the hospital?
Absolutely have heard that several times from several of the departments I hear, and it's an unsafe condition, and we certainly can't provide the appropriate level of service and treatment and observation for the patients that they deserve.
Falck told the ABC 7 News I-Team they're committed to improving 911 response times and are actively hosting job fairs and offering bonuses to recruit new hires.
We've shown steady improvement since it was at its worst a few months ago, and I think we're on the pathway to getting everything within contract compliance.
As for the galleys, they hope it stays that way, so others won't be stuck waiting.
If there's a staffing problem or any other issue with, that's something that needs to be fixed. I mean, this isn't the cable company where they're within a window, and if they're 30 minutes late, you can learn to live with it. That's not what those services are for.